All this is Dr. Mobeen Syed from Drbeen.com. Welcome to one more show. So today with us, we have Dr. Josh once more talking about Alzheimer's, talking about intermittent fasting, which is a topic really near and dear to my heart. So Dr. Josh, welcome.
Thanks. It's great to be back here, Dr. Bean.
So for our new audience, tell us a little bit about yourself, and I have your site ready as well, and then we'll start the discussion.
Sure. So my own background, I got into the whole Alzheimer's field because as a teenager, my grandmother, Eileen, got Alzheimer's, and I saw how it affected not just my grandmother, but my parents' generation, because they were like, hey, if she's getting Alzheimer's now, what's going to happen to us in 20 or 30 years? So I was a teenager then. I was a nerd. I was actually studying biochemistry. I ended up getting 2 degrees in biochemistry, 2 degrees from Harvard, excuse me, and went to a Harvard MIT medical school program. What else? I also ended up initially in emergency medicine. I got board certified in emergency medicine, and then also board certified in lifestyle medicine. And basically for the last 6 years, I've been focused on reversing Alzheimer's. And
Awesome.
I'm a medical doctor. I'm not formally a neurologist, but I find that many neurologists are not focused on the reversal and the root causes like I am. So
Understood. And so very quickly, I want to show your site as well.
sure.
And for the cool beans listening, I do not have any strings attached. There is no promotion happening here. There is no money changing hand. It is Dr. Josh speaking with you for the issues of Alzheimer. So here is drjosh.com. And I love his site. He's a prolific speaker. So look at it. He goes to various mainstream TV channels as well, talks about them, has his own podcast as well. And we are lucky that he's here with us as well. There is a mutual friend of ours, Margie, who had connected us. So thanks to her, we
Thanks.
have a gem with us. So
that's great. And I'll also say I'm chief medical officer at Hippocrates and Brain Power and Alzheimer's Treatment Centers of America. So you're right, I'm busy, but my primary goal is what we're doing right now, spreading hope that Alzheimer's disease is preventable and reversible. Right now, many people, it's not on their radar. They think that I'm talking fiction, and I'm not. I've been doing this for many years.
understood. So thank you very much. And we are starting now. We actually have this question that is going to come up later as well. So Melinda says, can intermittent fasting help to prevent Alzheimer's? So we'll discuss that. And I want to also answer, Melinda is saying, is the discussion that you and I did posted? And I was actually discussing that with Dr. Josh, and he said it's not posted yet. So we'll let you know. So with this, let's start our discussion. So first of all, Alzheimer's and intermittent fasting. What is the link? What happens in our brain when somebody is doing intermittent fasting, and what is intermittent fasting?
Yeah, so let's just start with definitions. Intermittent fasting means that you're not eating all the time. So the traditional way I and a lot of Americans were brought up is that breakfast is the most important meal, and you have to eat 3 meals a day and maybe eat some snacks, and you start eating when you wake up basically, and you keep eating until you fall asleep. And so I would say that unfortunately that is not how our bodies are designed to function optimally, that we're actually designed only to be eating during a certain time period. And that's what intermittent fasting is, where you only feed during a feeding window. So as an example for something that's healthier is, for example, skip breakfast. And maybe your first meal might be at noon, and then you would eat from noon until, say, 6 p.m. and go to sleep at 9 p.m. I like having a 3-hour buffer between my last meal and when I go to sleep. But specifically, academically, intermittent fasting means that you're not eating all the time. And it can be more severe or more lenient depending on your feeding window time, if that makes sense. And then the second part of the question is, can intermittent fasting prevent or reverse Alzheimer's? And I think in my clinical experience, I think the answer is yes. The challenge is getting clinical studies in people, because there are very few clinical studies in people. I was involved with one up in when I was in True North, which is a fasting center in Northern California. But if you look, there are very few fasting studies in people. So I can tell you about there are definite strong studies showing intermittent fasting in rodents definitely prevent the rodent model of dementia or Alzheimer's. That's interesting, but often, we're not exactly the same as rodents. So,
And one of the challenge with these studies that you're saying, it is difficult to ask human beings that, hey, I'm going to do an experiment. I want you to not eat or drink anything for next 3 days, and that's just not going to happen. That is why also there are less studies. So the question now, brain inflammation and its, of course, role towards dementia and Alzheimer's, and then how does intermittent fasting help against that?
yeah, so the exciting thing is that fasting helps decrease brain inflammation. And we can talk a little bit about why is that. It turns out that when you fast, your body and your brain shift fuels from carbohydrates to ketones. And it turns out that ketone bodies will basically burn cleaner to the extent that you have less oxidation, and then number two, you have increased production of GABA. You have a shift. There's this. You can tell I love biochemistry. There's an enzyme called GAD that converts glutamate to GABA. When we're fasting, when the brain is living off of ketones, that enzyme gets activated and you get more GABA, which is a calming neurotransmitter, and less glutamate, which is an excitatory neurotransmitter. So for that reason, the electricity in your brain goes down and people feel, it's interesting when people are fasting, often they'll feel relaxed. It can be, most religions actually include fasting as part of the religious practice because, and I think that's the reason why, if your brain has more GABA, you actually have more calmness to reflect on whatever it is you want to reflect on.
Understood. Thank you very much. And for the audience, Luffy is in the room as well, and he just continues to try to sit with me. So my apologies for any disruptions. So the role of ketones and what role do they play in the neuroinflammation, brain metabolism, cognition?
Yeah. So again, ketones burn more. It's not as dirty a metabolism, so you get less oxidation with ketones. So basically, the brain can use two different types of fuel. It can use glucose or it can use ketones. Now, what will happen is the longer that you fast, and at places like True North, we would do water fasting for up to 40 days. So to me, fasting, there are different amounts of fasting you can do. You can say skip breakfast. That's, some mild intermittent fasting, or you can actually, for many days, you can just drink water. And the more water you drink and the less you eat, the more ketone bodies your body will produce. And the more ketonic you go, then you get decreased inflammation in the brain. That's one piece. Another piece is if you're doing a prolonged fast, if you're just drinking water, you're you're not putting any fuel in for your gut. And most people have huge amounts of inflammation in their gut. So you can imagine if you're just drinking water and not feeding, that the bugs in your gut, the microbiome, they're basically going to die off and not produce as much inflammation that way. So like many things in life, there are so many different pathways, and I've just talked about a few of them.
Understood. Thank you very much. And so the next question, and audience, if you're seeing me making faces, Luffy is sitting in my lap and kneading away at my
Oh
thighs. And
no.
so, it is an unexpected guest today with us. So, Dr. Josh, the next question, BDNF. What is BDNF? What is its its association with the neuroinflammation? And then what is the effect of intermittent fasting on BDNF?
Yeah, so BDNF stands for brain-derived neurotrophic growth factor. And BDNF is a growth factor that specifically increases the growth of new neurons and then also new neural connections or synapses. So that's a good thing. We want our brain to regenerate. So what's really exciting is that intermittent fasting and fasting in general will promote the um, release of BDNF. And something very interesting from a biochemical standpoint, it turns out that when you fast, the cells in your body have basically the cells in your body have the almost identical experience to when you exercise. So exercising and fasting from the perspective of your cells are almost identical processes. Now, the next question is like, should I exercise and fast at the same time? I think that's okay. Like if you skip breakfast, sure, go work out. Now, that's not true if you're doing a 3-day or a 7-day or a 20-day water fast, because if you try to exercise while you're doing an extended fast, what's going to happen is your body will preferentially try to get fuel from your muscles, and you're going to get muscle wasting, which you don't want. You don't want your muscles to go away. So, but what's exciting, and this is one example, whether you're fasting or you're exercising, you're actually stimulating your brain to release this BDNF that causes regeneration of your neurons and your brain, which is a great thing if you're trying to prevent or reverse dementia.
Excellent. Thank you so much. Uh, Another very interesting question, and I have once again a great interest in this one, and that is insulin resistance. Because I believe once we develop the resistance, then we start developing inflammations everywhere, then we start developing glycation, and then the whole thing just goes downhill from there. So, does intermittent fasting help improve the brain's insulin resistance?
It does. That's exciting. That again, both exercise and fasting, intermittent fasting, will promote insulin sensitivity, which is a great thing. And and diabetes type 2 in conjunction with Alzheimer's has been labeled type 3 diabetes. So when we're talking about Alzheimer's, there's normally between 30 and 200 root causes. Some of the common ones include insulin resistance. So that's why intermittent fasting, not eating 3 hours after, yeah, having at least a 3 hour window between your last meal and when you go to sleep is amazing for decreasing your insulin resistance, which is
That is
basically,
amazing.
it's basically you're optimizing your metabolic system.
This is amazing, and this is a huge benefit because once the insulin sensitivity is improved, then the brain's cellular operations are improved, reactive oxygen species are reduced, and of course, dementia's progression or leading towards dementia and Alzheimer's would reduce as well. So, thank you for this tip. So, now the question more in line with the Alzheimer's. Is there any evidence, are there any studies for intermittent fasting and Alzheimer's and their link?
Yeah. So what I would say is, like I mentioned, I've had clinical experience seeing the improvement. I'm not aware of studies in humans. There are many rat or rodent studies, but unfortunately I don't see when it comes
Understood.
to studies is who's going to pay the
Yeah,
millions of
plus it
dollars
is
to
difficult
do
to
that study.
follow people for
Yeah,
a long time for Alzheimer's and its progression.
yeah,
What is your clinical experience so far?
yeah. So far, and again, this is over 6 years. Is uh, I've seen people's dementia and Alzheimer's improve. Now, to be fair, I'm normally recommending other things besides intermittent fasting. They'll be getting supplements, they'll be exercising, they'll be getting deep sleep, decreasing their stress. But to my mind, intermittent fasting is a free way that you can tweak your lifestyle to improve your brain function.
Understood. So then continuing with the intermittent fasting, what is the cellular effect of intermittent fasting on the brain neurons, the senescence, and the other inflammatory issues that we have?
Yeah, so the exciting thing is it actually turns down the inflammation. And it does that in many different ways, including what I mentioned in terms of decreased reactive oxygen species, and and also that you get increased amounts of GABA, decreased glutamate. So you're turning down the electricity in the brain.
Understood. Thank you very much. So before I continue, I have a question from Melinda. She says, does intermittent fasting help migraine?
Yes, I've definitely seen it help. It's it's interesting. Migraines have potentially different causes. So in general, intermittent fasting will um, decrease um, the electricity in your brain and inflammation, and that can decrease the migraine. But I'll say there are other confounding factors. One example would be, let's say you've got someone who's addicted to caffeine, and as part of their intermittent fast, they're not taking in caffeine. You can get a caffeine withdrawal headache. But I would definitely recommend, if you're someone who gets migraines, try the intermittent fasting. You may find that it goes away when you're not eating.
Understood. Thank you very much. So is intermittent fasting a viable tool for the brain health, the neuronal health, preventing or slowing down the mild cognitive impairment or MCI?
Yes, it actually helps with all of those things because you're optimizing your metabolism, including your brain metabolism. So yeah, so I recommend it. I don't recommend it on its own. I'm normally recommending a bunch of different things, but I'm okay with people starting there. And I should also say that intermittent fasting to me is also like exercise, in that wherever you are, you can get a little bit better. So if right now you're like the standard American, eating 3 or 5 meals a day from when you wake up to when you sleep, then just try skipping breakfast or pushing back your first meal till 10 a.m. or 11 a.m. Just like with exercise, if you're not exercising at all, start with a 5 minute walk. But if you're experienced with intermittent fasting, say a window from noon until 6 p.m., and that's the only time period you're eating, then you know what? Maybe one weekend try doing a water fast, for 48 hours. And I don't normally recommend people do more than a couple days of water fasting without medical supervision. At True North, we were rounding on our patients a couple times a day.
Understood. Thank you very much. And I think this is a good segue to actually talk about the timings and protocols of it. So, what is it? How many hours can be between the meals, and how many hours should be in the sleep while we're fasting? So, what are the types of intermittent fasting that you have experienced with, and what is your best fast durations?
Yeah, and this is a hard question to answer because everyone's a little bit different, has a unique. Um, I personally, I find skipping breakfast and maybe doing my first meal at noon and then eating until 6 p.m. That that's ideal for me. But there are some people who will only eat one meal a day. So that if you're eating one meal a day, that would be, let's say you eat for an hour, and then for 23 hours a day, you're not eating at all. So I think, and then the question is like, should that large meal be in the morning or at night or at lunchtime? And I think the answer for all these are, everyone's different, whatever fits in your lifestyle. And the cool thing is, you basically can compete with yourself on this. So
Understood. So, I want to talk about the variability of the intermittent fasting for various people. I think women in, you know, at an early age may have a different requirement and effect of intermittent fasting on them Similarly, somebody who may be a patient for some diseases could have. So, is there variability in the intermittent fasting's impact, and should people figure out how to do it for themselves?
The answer is yes. And for example, if you're pregnant, you certainly shouldn't be doing water fasting. Um, but in general terms, um, you know, I don't like categorizing like women should fast this way, men should fast this way. I think everyone's on their own unique journey. Now, if you happen to be a type 1 diabetic, things are a little bit different because we don't we don't want your your blood glucose to go too high or too low. But apart from type 1 diabetics, um, it's
Understood.
yeah.
Understood. I had read in some of the articles that women who are in the fertilization age, it is possible that intermittent fasting, because there is going to be a reduction of some nutrients and fats, that their hormonal imbalance can occur. So I think in that case, women can notice how their body is responding to intermittent fasting and then adjust that. I have a question for you.
Actually,
During the
before we go there, just to say in general terms, one way to think about all this is that our ancestors thousands of years ago normally intermittent fat. They didn't have a choice. They didn't have access to food
yeah,
24/7 like we do. And have our genes changed a little bit in the last 1,000 years? They have, but not significantly. Our metabolic pathways are still the same. So that's why whether you're a man or a woman, young or old, that I think we are as humans, we're designed to be resilient. And
mm,
and actually, if you're eating the typical American way of 3 to 5 meals a day, that's not ideal metabolically. Our cells are designed to not have periods of over excess. We're actually designed to have periods when we can recycle and get rid of um, malformed proteins, and that time is normally done during the fasting. So we're designed to have fasting periods, and so I wouldn't shy away from it. It's funny in our
understood.
society, you watch people say like on an airplane, and they act as if like if they can't eat in an hour, like they're gonna die, and that fortunately we're not designed that way. But
Mm.
I understand if you're hooked on carbs and if you don't have your hit of carbohydrates, you're going to get depressed. I understand that. It's just again, there's way too much added salt, oil, and
Mm.
sugar in the Western diet.
Understood. Very good point. Thank you very much. So the this question is very commonly asked of me as well, and that is, number one, can you eat something or drink something during the fast? And number two, when you're breaking a fast, is there some specific kind of foods that you should take or not take or care for, or some are better?
Yeah. So, and those are great questions. So, and and I think it's controversial, which is probably why people are asking. And here's my opinion. I think the purest fast is going to be just drinking water. And that I saw great results with that at True North. Having said that, I mean, I personally will sometimes when I'm water fasting, I will take in, say, uh, a supplement like Cardio Miracle that has 10 calories. The key here is I'm not doing enough calorie to take me out of ketosis. You Carbohydrates and calories will basically turn off and end the fast. So I think if you're hovering at a very low amount, I think like 10 calories, I think you're okay. The challenge is, so I think the purest type of fast and the ones I've seen greatest results are when you just drink water. Now, up from that, or a little bit not as effective, is drinking juice fasts, where guess what? There's calories in juice. If you're whatever type of juice you're drinking, you're not going to get as ketotic as drinking water. Having said that, if you just today all you do is drink juice, you're actually it is going to be beneficial, that type of juice fast. So, but um, and then you were saying what's the best way to end the fast? I would say it really depends what type of fast. If you just skip breakfast, then I think it's perfectly fine just to eat a normal lunch. Now, if you're doing a water fast for 3 days or up to 40 days, the refeeding period is the key period, because if you don't start low and slow, you can actually end up in the hospital. Because think about it, if you've given your gut, your GI tract a break for 4 days or 40 days, your gut has been relaxing, and if all of a sudden you give it a high fat, complicated cooked meal, high caloric cooked meal, you're all of a sudden going from completely sleeping to, say, go full gear. And there's something called refeeding syndrome where people will get extremely sick if you do that. So instead of, after a long water fast, instead of starting with complicated cooked food, you start with things like watermelon or juice, simple calories, and then after a few days, then you might advance. And I made this mistake when I did a 10-day water fast. On day 3, I really wanted oatmeal, and in the refeeding protocol, it was allowed. And so instead of starting with a really small bowl of oatmeal, I had a really big bowl of oatmeal, and I was really hungry, and I ate that quickly. And then my gut told me pretty soon, like, within a minute, like, you shouldn't have done that. So again, it's interesting how your brain will say, I need it, but you really have to listen to your gut.
Understood. Thank you very much. So before the next question, there are some questions in the audience, some more questions here as well. So the few questions. Number one, Melinda. Today, Melinda is taking the trophy for the most questions. What is the impact of intermittent fasting on mitochondrial dysfunction?
Yeah, so the exciting thing is intermittent fasting will help improve the health of mitochondria, specifically the quality of each mitochondria and the number. There's something about fasting that promotes the growth of the improvement and the growth of the number of mitochondria. So, which actually makes sense, because we know that fasting improves metabolic health, and it turns out that mitochondria are present in almost every cell of the body, producing energy. So it makes sense that's actually the mechanism.
Understood. Thank you very much. Another question. Jamlin says, if I'm pronouncing your name correctly, is there any way to measure the effectiveness of intermittent fasting, blood markers other than glucose? Is homocysteine linked at all to fasting? And you're, of course, welcome, Jamlin.
Yes. So, all right. So glucose is one. You're right. Glucose is one way to measure it. Another one is to look at what's called hemoglobin A1C, which looks at your glucose level over the last 3 months. But another measure, specifically with longer fasting, is to see if you get ketotic, if you produce ketones in your urine, for example, or your blood. And normally, if you just skip breakfast, you're not going to produce a lot of ketones. But if you water fast for 3 days, you are going to see lots and lots of ketones. So I'm not aware of any other tests that will tell you that. And then the next question was about homocysteine. I'm not aware about homocysteine being linked to fasting. Homocysteine is an amino acid that you want to keep the levels low, because normally homocysteine can do damage to blood vessels.
Absolutely. And
But long term, um, I think fasting could improve homocysteine, but normally, if homocysteine is not good, it's because often it's genetic. To be awesome, to be honest with you, because homocysteine metabolism is related to methylation, and everyone has slightly different genetics when it comes to the pathways there. As an example, I like a supplement called creatine to lower your homocysteine levels in addition to B vitamins. So, I mean, you're balancing all these things out. So if normally you take a supplement with B vitamins and creatine, but then you stop because you're fasting, yeah, there's so many variables here.
Understood. And just for a quick, I'm a mechanisms lover as well. So the what happens is that when we have SAM or S adenosyl methyl, which gives us the methyl groups. So SAM is converted to homocysteine when it gives a methyl group, and the homocysteine there is an enzyme called MTHFR, and that is what you're talking about, genetic deficiency or modification. MTHFR converts homocysteine back towards SAM or methionine, and for that it needs the vitamin B12, folic acid, and if they are deficient, then this homocysteine does not recycle correctly. And then from methionine there is another pathway that goes to cysteine, and for that we need B6. So vitamin B12, B6 and folic acid deficiency plus MTHFR genetic deficiency can also impact the cysteine and homocysteine. Anyways, that's a different topic, and I don't want to get too much into it. Um, I would have one more addition here for the tests. Because intermittent fasting is supposed to help with the inflammatory conditions as well, C-reactive protein, interleukin 6, and tumor necrosis factor alpha may also be interesting to track over time just to see
Sure.
if the inflammation is reducing. I
Agreed.
have one more question before I ask my questions, and that is
Actually, one more comment though, because we were talking about how long should you fast. I would say even 12 hours of fasting can be helpful. So
absolutely
don't feel bad if you're not doing a multi-day water fast. Yeah, yeah.
understood. So there's a question more about the water fast, but I'll generalize it as well for intermittent fast. And that is Rich is saying, what about drinking coffee and bone broth during a water fast? And can I editorialize this question to say,
Sure.
what about taking these things during an intermittent fast?
Yeah. So again, my own personal practice and recommendations. I don't normally recommend that people drink coffee or bone broth. And certainly at True North, we were just giving pure water. We weren't giving coffee or bone broth. I can understand that coffee normally doesn't have many calories, especially if you're not adding sugar and creamer to it. Um, and bone broth has some. I worry, and this is a whole other discussion too. Both coffee will have acrylamide toxin, and bone broth often will have high levels of heavy metals. So, to my mind, normally when we're doing a water fast, we want to get rid of toxins. And unfortunately, both with coffee and bone broth, you would then be reintroducing toxins.
Understood.
Yeah.
Understood. Thank you very much. And Melinda says that I am incredibly inquisitive, Dr. Bean. I love learning. Awesome. This is a learning channel. So thank you very much for helping us move the discussion forward as well. I appreciate your questions. Um, then there is a question from Hillary. She says, is there any information about women with PCOS and intermittent fasting? If you're born with a tendency for higher insulin production, does this cause
Yeah,
issues?
so I've seen good results with intermittent fasting and PCOS, or it's called polycystic ovarian syndrome, which is becoming more and more common. I think as we're getting more and more endocrine disrupting chemicals, whether that's forever chemicals or pesticides and heavy metals. So yes, I've definitely seen good results using intermittent fasting. And then if you're born with higher tendency for insulin production or insulin resistance, um, no, I don't think that this is going to be an issue to intermittent fast. With the only exception is if you're a type 1 diabetic, and then
Understood.
and then you could still do some fasting, but you would have to modify it a little bit.
Makes sense. Thank you very much. Mauro says, is the 16 hours intermittent fasting also good for mitochondria?
Definitely, yeah. So just even just 12 hours is good. 16 is better. 24 is better. And here's a fun thing: is you can start out and just say like, I want to do a 16-hour fast, and then when you finish the 16 hours, you can say, wow, how am I feeling? Do I want to continue longer? And and again, the cool thing is you don't have to decide in advance, because one of the challenges is when you're fasting, often your energy level will be lower, which, if it's the weekend and you don't have any commitments, that's fine. But if you've got to work or have meetings, sometimes it can be difficult. And and everyone's different. And what's really interesting is that in the same person, it could be very difficult to do those 16 hours initially, but the more you do it, the easier it becomes. So that's why I want people just to get started, and don't be competitive with your neighbor necessarily, because they have a different metabolic system than you. Um, but yeah, those are my thoughts.
Understood. I still have to go back to my list of questions, but I have some more questions. So Melinda says, is it good or safe to do intermittent fasting with acute illness, for example, cold, COVID, flu, etc.?
Yeah, Melinda, I love this question, because it turns out that in people and other animals, when we get sick intentionally, our systems are often designed to take away your appetite, because when you eat, that takes an incredible amount of energy and blood supply and focus of your body to digest that food. When you're sick, what really that energy should be diverted to your immune system. So often, whether you've got the cold, a COVID, flu, etc., your body will be saying, I'm not hungry, don't touch food. And this is one of those cases where you need to listen to your body, because I don't know about you all. I was brought up like, if I'm sick, my mom would be like, oh, have some chicken soup, eat something, you'll feel better. Like, no, it's the exact opposite. Listen to your body. If your body says, I don't feel good, I've got a fever, I'm not hungry, drink some water, but that's all you should be doing. Looks like you're muted. Dr. Bean, you're muted now.
Thank you. So some of the questions from my list. So number one, what mistakes are made to keep the fast or during the fast? What should
Yeah,
people be careful about?
yeah. So what I would say is, um, I would be careful about planning. I would not be planning to do a long water fast if I have an important interview to do, or uh, if I know I need to have a strenuous exercise at that same time. So I think being realistic and planning that when you're fasting, that should be a time when you're not doing something high stakes, energy consuming. But what's really fascinating is, as you get better and do more of these fasts, often your thinking will be a lot clearer. Your energy level might be lower, but your thinking will be clearer, because the inflammation level and the electricity level will be turned down in your brain.
Absolutely. So I was fasting a few weeks ago, Ramadan, and I was saying to someone that in Ramadan, my brain becomes like sharp, like a tack. I think so clearly, and it is just so. At that time, learning and teaching is so fun because things just start becoming clear. So yes, there is a lot of sharpness that comes with this. Uh, how do people start intermittent fasting?
I think there are lots of different ways, but I would recommend just skipping breakfast, because again, I think breakfast has been oversold. The media in advertising decades ago basically they were pushing breakfast cereals, and they the jingle was, breakfast is the most important meal of your day, and I would say it's the exact opposite. Normally you don't need breakfast. So to me, the logical place to start would be just to skip breakfast. Silence. All right. Let's see. see if there are any comments here. Christine says no coffee. Yeah. So again, if you drink coffee, I'm not opposed. If you're fasting while you're drinking coffee, I'm not opposed to you doing it. I would just say I would not add creamer or sugar. You want to keep the calories low, and plain coffee normally doesn't have any uh, sugar. All right. I don't know what happened to Dr. Bean, but we'll keep taking your questions. Um, how does intermittent fasting impact long COVID and chronic fatigue syndrome? So I've actually seen good results with fasting as a way, because with those conditions like long COVID, the root causes are often, there might be 10 root causes, including not just the long COVID, but inflammation, many toxins, many infections, um, etc. So the cool thing is when you fast, the electricity of your brain goes down. Okay. See the next question here. Christine says, I never eat breakfast but coffee with milk. Well, what I would say is try water, try tea, or try coffee without the milk. All right. See the next one. All right. Hillary wants me to explain electricity in the brain. That's a great question. It is kind of like a mental hyperactivity. So, in the best way I can describe this is in one of the clinics I worked in reversing Alzheimer's, some of the patients would have seizures where it was obvious. They would, you see their arm going, etc. And if I put one patient who was having seizures next to, you're back, Dr. Bean.
My network just disconnected me from the talk. Good thing is you continued. So thank you.
Let me finish this story, and we'll take your next comment or question. So if I took one patient who was having seizure activity, increased electricity in the brain, and I put that patient next to another one of my patients, that other patient would then start having a seizure, meaning that there was actually electricity traveling from one patient to the other. And so, yes, that's what I mean by electricity in the brain, that there's so much inflammation that there is actually electric charge and traveling from one patient to the other. And again, this didn't happen just once. This happened predictably every time. Now, we didn't publish this. We didn't, take a meter to measure that amount. But I would say about 20% of the patients I had with dementia or Lyme disease or mold toxicity had this. And I believe what's happening is that there's a problem in the sheath around the axons, and being destroyed by fatty toxins. But again, that's just a theory. But that's what I meant by electrical activity.
Understood. Thank you very much. So Margie says, what do you think is the lowest hanging fruit for people who are organizationally challenged or unable to achieve perfection in terms of optimal lifestyle?
Yeah, I think that's a great question because, Marjorie, you're not alone. Many people are organizationally challenged because we live in a super chaotic society. So, we're talking about fasting. I think getting from a lifestyle perspective, skipping breakfast, uh, and or allowing 3 hours from your last meal to when you go to sleep, that would be a great place to start. But I understand just starting that the first time you skip breakfast, if you never skip breakfast, it's not going to be fun. And what I would just say is tough it out, because there's going to be a reward at the other side. Our brain is fascinating, where we get into these cycles, And if you try to do something different, your brain, which is addicted to salt, oil, and sugar and calories, is gonna be like, "Well, why can't I have my sugar?" And but the cool thing is we can train our brain, which guess what? We're using our brain to train our brain. So it's kind of meta, but it's fascinating.
Understood. Very nice. Thank you for this. Last couple of questions. Number one, I think you already talked about the breakfast. Is it the most important or not? And I think that is when I was getting, uh, and I think you discussed this as well, that how do people start intermittent fasting? Have you already discussed that part?
Yeah, I mean, there are lots of different ways. I personally prefer skipping breakfast, but there are, you could just have an a mid-afternoon meal, and that could be your last meal of the day.
Understood. This is a very good question. B. Slaughter says, is fasting okay during night, sleep until lunch?
Yeah, I think that's perfectly appropriate. Yeah, so
Okay, excellent.
I would recommend that. Yes.
Excellent. So, is intermittent fasting safe for people with a history of eating disorders?
This is controversial. So it depends. The challenge is people with eating disorders. I would recommend you get professional help, just because I've definitely seen people with that history run into trouble with fasting, where then it turns into um, doing too much, or binging and purging. And so because it's a much higher risk scenario, I would suggest you get professional help, just to make sure you're on the right road.
Understood. Last two questions. One from the audience. Ruth says, diabetic, can I fast?
Yeah, so what I would say is definitely talk to your doctor about it. And it would also diverge in terms of what type of diabetes. Is it type 1 or type 2? Um, Normally at True North or other fasting centers, if you're diabetic, we will normally not let you do a water fast. We let you do a juice fast, under some strict controls. But this is also a scenario where I would get expert professional advice, because the last thing you want to have happen is having your blood sugar go way too low. That can be toxic. Less common, but you could get it go too high. So that's another scenario where I would get a one-on-one consult with me or with another professional.
Understood. And once again, to find Josh, I'm going to quickly present uh, Dr. Josh's website. So this is drjosh.com. So simple. And as I had announced before, I have no strings attached. I actually am very glad that Dr. Josh actually joins us and shares these informations. This is actually his profession, his work, and we are getting free access to all this knowledge.
But I'd also put a plug in. I have a podcast, and the episode that just dropped today happened to be on fasting. I interviewed Dr. Jockers, and you can find that at drjosh.com/podcast.
Excellent. Thank you very much. So my last question. There is a belief that the intermittent fasting causes muscle loss. If that is the case, true or not, we'll hear from you. Does this do the same to brain as well? What happens to brain if you are intermittent fasting? Is there any tissue damage?
Yeah, so that's a great question. I don't see a lot of muscle loss with intermittent fasting. I definitely see it in someone doing a water fast for a week or 2 weeks or 3 weeks. Um, but for intermittent fasting, I haven't seen it. The good news is, no, I don't see brain cell destruction. What I do see during fasting is something called autophagy, where the body eats itself. That's what it means. But it's basically recycles and gets rid of damaged protein throughout the body, including the brain. So, to my mind, intermittent fasting and fasting is a great way to help regenerate your nerves and the rest of your body, because you're it's a period when your body can help recycle and renew and get rid of the damaged proteins and other molecules.
Understood. Thank you. I said that was the last question, but let's make this one the last question. Svetlana says, can we continue intermittent fasting even if we take coffee with coconut oil?
Yeah, so it turns out coconut oil is extremely calorie dense. So I would say it is possible if you drink the coffee without the coconut oil. But to my mind, coconut oil specifically is going to isn't beneficial. So I would just try it without the coconut oil.
Understood. Thank you very much. And so thank you very much for sharing your insights as well. We took 52 minutes of your time as well, and I'm sure that it is valuable for the audience. If you like the questions and the answers that you receive, please share it with others as well. There may be so many who can benefit from this. And Josh, once again, putting you on the spot, I would love to have a discussion with you for your favorite supplements and
Okay.
why are those your favorite supplements. Would you like to discuss that?
I would love to come back. This is a great forum. You're a great host, and the audience here, I love these questions. They're right on the money.
Okay, awesome. So we will
let's do that soon, maybe in a week or two. Yeah.
Okay, perfect. So we'll set that up. And with this, Dr. Josh, thank you very much for joining us. Cool Beans, thank you very much for joining as well. Please like, subscribe, and share, especially share because this would help others as well. With this, thank you very much and bye for now.
Peace and plants. Bye-bye.